Hello everyone, welcome to my channel Daily Drug Info, and don't forget to subscribe Daily Drug Info to watch new videos. Today I will describe snake bite management. Drug anti-snake venom serum, generic name polyvalent equine immunoglobulin. Its composition: anti-snake venom serum is a sterilized preparation containing purified and concentrated immunoglobulins, obtaining from the serum of a healthy horse immunized against the venoms of following four poisonous snakes of Pakistan, namely cobra, carrot, bestial viper, saw scalp viper. First aid: snake bite is a medical emergency and it should be treated immediately. The measures to meet the emergency should be quick. The following first aid measures may be taken. Number 1. Remove the patient to a well ventilated and quiet place. Assure the patient that there is no reason to be nervous or frightened. Also try to gain his confidence. Number 2. In case of bite on limb, apply a pressure bandage to control flow of blood and lymph from the area of bite. In case of leg, apply the pressure bandage above the knee, and in case of arm, above the elbow. Partially release the pressure bandage after every 10 minutes. Management at first level care facility. The medical practitioner should manage the patient as an emergency on top priority according to following ABC methods. Number A. Assessment. Assess and confirm about snake bite. Presence of fang mark, local pain, edema, and numbness are considered indicators for snake bite. B. Bath. Bath the wound with water if venom is visible. Number C. Comfort and reassurance. Avoid panic and assure that patient that there is no reason to be nervous or frightened. Remove the constricting items like belt, watch, ring, shoes, bracelet, or tight clothes. D. Dressing and immobilization. Apply pressure bandage and immobilize the patient with would delay venom spread. E. Essential life support measures. If patient in the shock and require cardiopulmonary resuscitation, then treat accordingly. F. Find transport for nearest hospital. Management in hospital. Number A. According assessment of snake bite, the attending physician should assess the bite, shape and numbers of PODs, which are identification marks, P. Puncture, O. Oozing of blood, D. Discolorization, S. Swelling. B. Remove the pressure bandage if applied previously during first aid treatment. C. Maintain N-line for transfusion, either infusion or blood isotonic solution to avoid shock and hemorrhage. Specific serum treatment. Once the venom has got into circulation, it is in the anti-snake venom serum that can neutralize it. At first, the dose of 10 to 30 ml of the serum will be injected intravenously very slowly. The second dose can be repeated 2 hours after the first dose or even earlier depending on the condition of the patient and severity of the symptoms. Further, dose can be repeated after 6 hours interval until the symptoms disappear completely. 1/3 of first dose of anti-snake venom serum can be administered locally to prevent gangrene development, especially in case of viper's bite. Antiserum can be diluted with isotonic solution. The quality of isotonic solution can be determined at the rate of 5 ml per kg body weight. Note: adrenaline 1 ml ratio 1/1000 solution subcutaneously or any other antihistamine should be kept ready to treat any unfortunate allergic reactions of serum. Clinical and laboratory investigations. Following clinical and laboratory investigation will be helpful in management of snakebite case. Pulse, blood pressure, and respiratory rate should be monitored on half-hourly basis. Body temperature, urine out should be analyzed. Diameter of bitten limb and estimation of proximal spread should be monitored. Neurological assessment should be carried out. For example, check the level of consciousness and reflexes. Blood CP, clotting time, prothrombin time, HB level, serum bilirubinuria, electrolyte, LFT, and blood cross matching should be carried out according to the requirement. Precautions. Following measures should not be taken. Number 1. Never use chilling, freezing, or cryogenic agent. Number 2. Never apply chemical to the wound other than recommended by physicians. Number 3. Never attempt surgical procedures. Number 4. Never cauterize the wound or surroundings of the wound. Number 5. Never give electrical shock to the patient. Storage. The product is potent for 2 years from the date of manufacturing if kept at 2 to 8 centigrade. Room temperature deteriorate the protein content of anti-snake venom serum. Strength. Anti-snake venom serum is supplied as 10 ml liquid in glass vial. Disposal. Leftover anti-snake venom serum and used empty vial should be disposed of as biomedical waste. Thank you for watching Daily Drug Info.